1.
According to the website bupa.co.uk, there are no specific tests for ADHD. The specialist will observe your child and look at reports of his or her behavior. Today, I will be discussing 3 key areas to be aware of about children with ADHD. The 3 areas I will be covering are how children are diagnosed with ADHD, symptoms of the ADHD medication on the child, and other options instead of medicating the child. I will be focusing on ADHD in children, although it does affect teenagers and adults. There are many signs that doctors look for before diagnosing children with ADHD. According to cdc.gov, deciding if a child has ADHD is a several-step process. There is actually no single test to diagnose ADHD, but the American Academy of Pediatrics uses the DSM-IV-TR to diagnose children from ages 6 to 12 with ADHD. The DSM-IV-TR is split into 3 different categories: inattention, hyperactivity, and impulsivity. Some behaviors that doctors consider when diagnosing a child with ADHD is if they are always in constant motion, squirmy, they do not seem to listen, they have a difficult time playing quietly, they talk excessively, are easily distracted, or unable to finish tasks. It is actually very hard to diagnose ADHD in children younger than 5, and just as hard once they become a teenager. It is hard to diagnose a child under 5 with ADHD because they do carry the same characteristics as a child with ADHD, such as not being able to sit quietly, not being able to sit for long. When a child is being assessed, there are many people that are involved, such as the parents, the caregiver, the teacher, and also other family members, and the doctor considers everything that they've observed about the child. There are many symptoms that ADHD medications can have on the child. According to NIMH.nih.gov, in 2007, the FDA required that all makers of ADHD medications develop patient medication guides that contain information about the risks associated with the medications. The medications can possibly lead to cardiovascular and psychiatric problems, but is not limited to just those issues. There are other symptoms from ADHD medications, such as decreased appetite. The child does not want to eat as much as they used to. Sleep problems, they're either sleeping too long or too little. It can increase their anxiety, irritability, they're angered easily. It can cause them to have mild stomach aches and also mild headaches. It can cause them to develop tics and personality changes. With the tics, they are given a medication for ADHD and it might not fix one problem they have, so they're given another on top of another, which causes them to develop the tics. There are options available for hyperactive children other than being medicated. According to NIM.nih.gov, treating ADHD is a partnership between the healthcare provider, parents or caregivers, and the child. There are educational interventions, which includes the teacher helping the child, and there is also behavioral therapy. In conclusion, there are 3 key areas to be aware of about children with ADHD: the signs of children with ADHD, how they are diagnosed, the symptoms of medication, and other options instead of medicating the child.